Hello everyone, welcome back to UWorld's live NCLEX review. My name is Nicole. I'm a nurse here at UWorld, here to give you a question drill. If you are new here and don't know how a question drill set works, well, welcome in. Glad to have you. Glad to have you have stumbled upon me. It's going to be fun. I pull up a question up above me, give you about 30 seconds to review the question and the answers, and drop down what you think in the chat. I have a chat pulled up here, whether you're on TikTok, Instagram, YouTube, all the channels. We can get chatty and discuss why the right answers are right and the wrong answers are wrong. And then I give you some feedback and maybe some test taking skills and strategies to how to go about these questions. These are NCLEX style questions, so if you can master and get comfortable with answering these questions, I'm sure you'll do great on your NCLEX. Today's topic is effective teaching. So the last step in our CJMM model that has you evaluate whether the teaching that you did to the client, the student, the nurse, the other nurse, the parent, anyone that you're teaching, and maybe even yourself, are these correct statements? Do we need to intervene? Do we need to follow up? But you have to read the questions very, very carefully to make sure that we're following up, we're intervening, or we're having a correct understanding. So we'll go through that bit by bit with each question. We have Nurse Jackie in the chat moderating for me today. So if you have any questions or I go over an answer choice a little bit too quickly, don't be afraid to ask her for reiteration. And without further ado, let's get started. Question number 1. The nurse has taught the parent of a newborn how to suction nasal secretions. Which of the following statements by the parent would indicate a correct understanding of the teaching? Let me know what you guys think for this one in the chat. Option 1, I will compress the bulb syringe after I insert it into my baby's nostril. Excuse me. Option 2, I will suction my baby's nasal secretions only after feedings. Option 3, I may suction both of my baby's nostrils if necessary. Or option 4, I should clean the bulb syringe weekly. Let me know what you guys think in the chat. Hello everyone. Glad to see you guys. Whether you're joining on Instagram, TikTok, YouTube, Facebook, we go live on multiple channels. Be sure to like, follow, subscribe, all the things that the vloggers always say. But please make sure you subscribe. We are almost at our 100,000 follower goal on TikTok. So go to TikTok, follow us there. I would be so excited if we can get that goal by the end of the year. We just have a couple more weeks left and I think we're like at 98,000. We're so close. Tell all your friends to also follow, subscribe, like us. We are here to help you guys get ready for the NCLEX. So there's only one way that we can do that, is that if you are constantly watching us. So let me see some follows as well as I'm seeing some good answers in the chat. I'm seeing 1s and 3s. So kind of act this situation out since it is a nasal section. Which one of these statements are correct understanding, meaning that this is a correct intervention or correct action that we should be doing when talking about nasal suctioning? Still some good 1s and 3s. Let's break it down with this, and the answer is option 3. I may suction both of my baby's nostrils if necessary. So let's go back to the question. That bulb suction, it's a suction that we use, it has a small tip that is used to extract, that's the word I'm trying to look for, extract nasal secretions so the baby can breathe a lot easier. So if option 3 is our correct answer, because yes, you can suction both nasals to help them breathe out of both nostrils. So that would be the only correct statement here. Option 1 is incorrect. I will compress the bulb syringe after I insert it into my baby's nostril. This would be incorrect. I know a lot of you guys put this in the chat that you think this is the correct answer. If you compress it after you insert it, you are pushing air into the baby's nasal passage, which can further push the secretions or any blockages into the nasal passage. You want to compress it before you insert it into the nasal passage so that when you release the suction that you're sucking the secretions into the bulb and then you withdraw afterwards. But you make sure you compress it before you insert it into the nasal passage. Option 2, I will suction my baby's nasal secretions only after feedings. This is again incorrect. You have to be very careful with these words like only and weekly or like time constraints, because if they have any type of identifiers like that, it could make you have to make sure it's 100% right all the time. So only after feedings would be incorrect, because sometimes you would want to do it before the feeding so they can breathe easier while they're eating, because we all know breathing and talking and eating takes a lot of coordination. So if we can help alleviate that by sectioning them before feeding, that will be best as well. And then option 4 is incorrect. I should clean the bulb syringe weekly. This is another definitive word, weekly. You would definitely want to make sure you do it a lot more often than weekly, usually after every use, every couple of hours, to make sure that that bulb section stays clean and doesn't cause any more infection. So option 3 would be the only one that is correct the entire time. But you guys did pretty good. Next question. The nurse is teaching a client who is scheduled to receive chemotherapy. Let's see how you do with this one. Which of the following statements by the client would require follow-up? So since the question says require follow-up, meaning we are looking for wrong actions. This is a negatively worded question, so we're looking for wrong actions, things that we don't want to condone. So option 1, chemotherapy targets cancer cells in my body that are currently dividing. Option 2, my urine may contain a trace amount of chemotherapy for several days. Option 3, the lining of my gastrointestinal tract may be affected by chemotherapy. Or option 4, chemotherapy will be administered through a small peripheral venous access device inserted in my hand. Let me know what you guys think in the chat. This is the opposite, requiring follow-up. So we're looking for a wrong action, negatively worded. So far I'm seeing lots of 4s in the chat, which is great. Also, oh yeah, someone said that they just passed. Congratulations to you. Also, let me know if we have any other recent NCLEX passers. I would love to say congratulations. Or if you recently scheduled to take your NCLEX. I know it's the end of the semester. Graduations are coming. Love to give you a shout out for graduations. But you scheduled to take your NCLEX. Or if you're in that limbo and you're waiting for your ATT, I would love to give you a shout out. Regardless, let's get chatty in the chat. Let me know who is about to take their NCLEX or just passed. I see Emilio just passed. Congratulations to you, Emilio. Anyone else? Recent NCLEX passer. Leo just passed last week. Congratulations. Someone is graduating next week. Graduating tomorrow, Jenna. Congratulations to you guys. Who else? HESI exit exam. I had to take HESI exit exam as well. That's like an NCLEX in itself. Good luck to you on that. Someone said that they passed their NCLEX. Thanks to you guys. Thank you so much for shouting us out, but congratulations to you. That is amazing. I'm glad UWorld helped you succeed and pass your NCLEX. Someone is waiting for the ATT, and someone else is taking theirs this month. So good luck to all you future test takers, and congratulations to all you guys that just recently passed. And thank you so much for still tuning in. Just because you pass your NCLEX does not mean that you don't need to still keep your mind fresh and understand these different health topics and different NCLEX type of world. So stay tuned, always watch us, and thank you so much for watching us. So the answer for this question is option 4. Chemotherapy will be administered through a small peripheral venous access device inserted in my hand. I saw a lot of 4s, only a couple of 1s in this answer choice, but 4 is the correct answer. So back to the question, which of the following statements by the client would require follow-up? This was negatively worded, so that means we're looking for a negative thing. Negative action meaning we don't want this to happen. So we don't want chemotherapy to be administered through a small peripheral vein. Chemotherapy medications are vesicants, which means if they infiltrate a vein or they infiltrate any part of your body, it can cause serious damage to the vessels, to the tissues in that area. So we want to make sure that it's going through a very large vein or vessel, or even a port if able. So a small peripheral vein, especially in the hand, those are very, very sensitive veins, as well as a very sensitive area, so that could easily become infiltrated, and we don't want that. So that would be the correct answer, because we want to follow up. We don't want them to have it in a small peripheral vein in their hand. All the other options 1, 2, and 3 are correct things that we will be seeing with chemotherapy. Option 1, chemotherapy targets cancer cells in the body that are currently dividing. Yes, this is one of the mechanisms of actions for chemotherapy in general. They kind of wipe out the cancer cells, but they also take a lot of other cells as well while they're doing its thing. Option 2, my urine may contain a trace amount of chemotherapy for several days. This is true. Chemotherapy is excreted in the urine, and that can be, and it's metabolized in the kidneys, and it can stay in your system for a good 48 hours afterwards. So it can be in your urine for a good couple days afterwards. So that is a correct statement. And then option 3, the lining of my gastrointestinal tract may be affected by chemotherapy. This is also true. Chemotherapy targets any cell that is rapidly dividing, and we have a lot of rapidly dividing cells in our GI tract, which is also why we see a lot of GI symptoms when a client is on chemotherapy, because it is attacking that area as well. But the only answer that is an incorrect statement and incorrect action is option 4. We do not want to administer chemotherapy in a small peripheral IV line. So good job, guys. Let's move on to the next question. The nurse has taught the parent of a 6-year-old client with asthma who has a new prescription for an albuterol meter dose inhaler. Which of the following statements by the parent would indicate a correct understanding of the teaching? Select all that apply. Excuse me, keep burping. So select all that apply, meaning that there is more than one right answer. And lucky for you guys, on the NCLEX, you do get partial credit for the select all that apply. So let me know what you guys think down in the chat with this question. Should we, option 1, I should wait 30 seconds before administering a second puff of medication to my child. Option 2, my child should hold the breath for 5 to 10 seconds after each puff of medication. Option 3, my child should inhale quickly after each puff to fully take in the medication. Option 4, a spacer will help my child effectively receive the medication. Or option 5, I should shake the MDI before attaching it to the spacer. Let me know what you guys think in the chat. With these select all that applies, they can be tricky, but like I said again, there is partial credit. But one of the strategies I use to answer select all the apply questions is I read each line by line and kind of think of it as a true or false statement. So option 1, is this a true statement, and is every part of the statement true all the time? And then go to the next one, and then go for each answer choice. So let me know what you guys think in the chat. It is a select all apply, so it's more than one right answer. I see a couple people just put one answer. Maybe you're just confident with one, but partial credit, so you might as well add another one. Let me know what you guys are thinking. I'm seeing 1s, 2s, 3s, 4s, and 5s. A good combination of everything. Let me know. Let me know. Good job, guys. 2 4s and 5s, 2 5s. I still see a couple people only putting one answer choice. Go line by line. Is this a true statement all the time? And is every part of that statement true? It's also, especially with things with time, or like I said in the previous question, with like weekly or daily, you have to make sure that that is at least the minimum at the time. So I should wait 30 seconds before administering. Is that the minimum, or is that the maximum? So we got to make sure that we get to at least the minimum. So for that weekly question, weekly was not the minimum. We would definitely want it daily, or after each use would actually be the minimum. So 2 4s and 5s is what I'm seeing. Someone said a good rationale of 1 minute, which is true. cough, cough if anyone wants to change their answers. But that is right. So the correct understanding of the teaching is what the question is asking. So we're looking for correct interventions, positively worded, looking for correct things that hit the minimum. So that would be options 2, 4, and 5. So option 2, my child should hold their breath for 5 to 10 seconds after each puff. So that 5 seconds is that minimum that we're reaching to 10 seconds to make sure that medication, the MDI, the albuterol, gets and is absorbed all throughout their lung tract. So that would be correct because it's hitting at least that minimum of 5 seconds. Option 2, a spacer will help my child effectively receive the medication. That is a correct statement. This helps with the coordination because sometimes children are a little bit less coordinated than others. So it gives them time to actively inhale the medication by delaying it in the spacer before it actually gets to their mouth. And then option 5, I should shake the MDI before attaching it to the spacer. Again, a correct statement. You want to make sure that you are shaking the medication to properly mix the medication within the meter dose. Options 1 and 3 are incorrect. Okay, so with the time of the 30 seconds in option 1, that is not the minimum. The minimum is at least 1 minute before administering a second puff. So that 30 seconds is a little too soon, and if they took a big deep breath or coughed again, we might expel some of that medication that they just administered. So we want to make sure we wait at least 1 minute before administering that second puff. So be very careful with your times. And then option 3, my child should inhale quickly after each puff to fully take in the medication. This is again an incorrect action. If the child inhales quickly, they might not get it all the way down into the bottom parts of their lungs. You actually want to have them inhale slowly. Also, inhaling quickly can sometimes cause them to cough, and then if they cough after taking this inhaler, you can cough out some of that medication. So you want to have them inhale very, very slowly, or as slow as they can, to make sure that that medication goes all throughout their pulmonary system. But you guys did pretty good. Question number 4, the nurse is teaching a client with chronic pancreatitis. Which of the following information should the nurse include? Select all that apply. Option 1, supplement your diet with fat-soluble vitamins daily. Option 2, limit your consumption of alcohol to 1 to 2 beverages per week. Option 3, consider participating in a smoking cessation program. Option 4, take pancreatic enzymes with every meal. Or option 5, consume a low-fat diet. So again, it's a positively worded question and it's a select all that apply. So more than one right answer. Go by each answer one by one and make sure every part of the answer is correct. If it has a time or it has an amount, make sure that it meets at least the minimum for what you guys think. And let me know what you are thinking and maybe your rationale in the chat. Or if you're like deciding between the two and you might have a question, drop it in the chat and maybe I can speak through it without fully giving you the answer. Someone on YouTube just passed last Monday. Congratulations to you. That's so awesome. Someone was like, yes, I got it right. Good job, good job. Great work, everybody. Good job. Someone was asking for prioritization type questions. We actually did that a couple weeks ago, so it should be up on our page. If not, you could always find those question drills on YouTube. I feel like is the easiest to find it again. But I'm sure we'll be going over it again very soon. Good job, guys. I'm seeing lots of 1, 3, 4s, and 5s, 3, 4, 5. I will say with a select all that apply question, 99.9% of the time, it will not be all of the answers. So you got to leave at least one of them off. Oh, I guess y'all are leaving option number 2 off. But then I see some people saying 2, 3, 5, 2, 3, 4, 5. What are you guys thinking? Seeing 1, 3, 4, and 5, and you would be correct. So back to the question, which of the following information should the nurse include? This is positively worded. We want to include it in the care plan. We want to do these actions. So we're looking for correct interventions. Option 1, supplement your diet with fat-soluble vitamins daily. So chronic pancreatitis, this is an inflammatory condition that causes that tissue of the pancreas to become fibrotic, and you don't actually have the normal function of the pancreas. So that means that that pancreas can't secrete any lipase to kind of help digest the fat, and it causes a lot of GI upset and a lot of pain. You have a lot of pain. This usually happens for chronic alcohol use, and then autoimmune disorders, and sometimes even tumors. So with these clients, they have pretty much a strict diet plan, and they have to take these fat soluble vitamins daily because they have to supplement what their pancreas can't do. Option 3, consider participating in a smoking cessation program. This is always a good answer. If you see a smoking cessation program, it's usually always going to be a correct answer because we want people to stop smoking. Smoking makes their pancreatitis and any inflammation worse. So that would be correct answer. Option 4, take pancreatic enzyme with every meal. Again, the pancreas isn't working to its full potential. So taking these enzymes will help digest that meal with every meal. So this is correct. And then option 5, consume a low-fat diet. This is also correct because the pancreas digests a lot of fat. But if the pancreas isn't using its full potential, if we can substitute it with a low-fat diet so it doesn't have to work extra hard, that's a great thing. And then option 2 is incorrect. I saw not a lot of people put option 2 in the answer, which is a great thing. Limiting your consumption of alcohol to 1 to 2 beverages per week. We actually want them to stop drinking altogether. Alcohol is a complete contraindication with pancreatitis. It will only make it worse. Same with kind of like smoking. It will only make the situation worse and the inflammation worse. So we want them to stop drinking as well. So that was very good. You guys got that one easy. This is a special offer. I saw a couple of people say that they were not successful with passing their NCLEX on the very first time. So we are here to help you. We are always looking for ways to help you guys pass the NCLEX. And this is one way that we are hearing you guys and reaching out. So if you did not pass your NCLEX the very first time, we have a special offer for you guys. You can follow the link that Nurse Jackie will put in the chat, and you can upload your CPR report or your candidate performance results, and that will send you an email of a special discount offer or special offer off when you buy a UWorld subscription. So when you use UWorld, we are going to help you pass your NCLEX. So we're trying to make it easier for you guys. So maybe, especially during the holiday season, pay for this. But this is only for those who were not successful in passing the NCLEX the first time or anytime. So you receive that CPR report, upload it into the link that Jackie provided in the chat, and then we'll go from there. Question number 5. The nurse has taught a client with newly diagnosed asthma. Which of the following statements by the client would require follow-up? Select all that apply. And that, I feel like if we're having a lot of select all that applies, but partial credit, we're going to get this down. We're going to get confident with answering these select all that apply questions. Option 1, I should take ibuprofen if I experience a headache. Option 2, I will measure my peak expiratory flow rate daily. Option 3, I should avoid exercising to decrease my symptoms. Option 4, I will wash my bed sheets in warm water weekly. Or option 5, I should avoid taking inhaled corticosteroids during acute exacerbation. Let me know what you guys think in the chat. This one might be a little bit more tricky, but I think you guys got it. Shameless plug, and for me to just pub UWorld more and more, especially since I used UWorld way back when I was testing and trying to get ready for my NCLEX. But UWorld has so many new features and great features, and we're always listening to you guys to see what other types of things that you would love for us UWorld to offer. So one of the fun things is that question of the week that gets delivered straight to your inbox and emailed directly to you, so you can quiz yourself and kind of test your limits to see how well you are retaining the information all by yourself. So it's none of the questions that we do on the question drill. It's a specific question just for you weekly. So sign up for that at uworldnursing.com, as well as seeing all of our other features that we have, such as booking a Clexpert. A couple of weeks ago, or actually it's months ago now, we had a couple of different groups book us to have us come give them a private lecture. So get your nursing school friends, your nursing students, maybe even faculty. If you get your faculty, maybe they can help pay for it. But book a Clexpert and we could be your personal tutors and host a lecture that you guys might want us to go over. So lots of fun options. Just go to uworldnursing.com and see all the resources that we offer. Good job, guys. Keep those answers coming. Yes, Nurse Jackie is right. You guys are doing great. I'm seeing lots of 1s, 3s, and 5s with this answer choice. And the correct answer would be just 1 and 3. Requiring follow-up, this is negatively worded, so we're looking for incorrect options. Those other ones were positively worded. Now we're flipping it over, making sure you're reading these very, very carefully. So require follow-up, wrong actions, things that we don't want. So a client with asthma, this is a chronic inflammatory disorder again, which causes hyperresponsiveness of their airway, and that hyperresponsiveness can cause airway obstruction. So it's harder for them to breathe. So we want to do everything that we can to alleviate that breathing that is difficult by opening up the airways with maybe medication or steroids or corticosteroids, but we want to be using them in the correct way. So option 1, I should take ibuprofen if I experience a headache. This is actually incorrect. This is requiring follow-up because NSAIDs, which is ibuprofen, can trigger the bronchospasm or the bronchioles constricting even more. So we actually want to avoid that with clients with asthma because it only may exacerbate the problem even more. And then option 3 is correct because I should avoid exercising to decrease my symptoms. You don't want to necessarily avoid it completely. Like I said, with these definitive words like avoid and only, you're not necessarily avoiding it. You're just going to have to retrain your body to exercise in a different way. And sometimes even you can get medications to treat it before. That way you can still exercise. So avoiding exercise is an incorrect statement because you can still exercise with this asthma. Options 2, 4, and 5 are correct statements when talking about asthma. Option 2, I will measure my peak expiratory flow rate daily. This is making sure and assessing how well your lungs are taking in air. So this is a correct intervention and correct thing to do. Option 4, I will wash my bed sheets in warm water weekly. This is a very good thing to do and clean intervention because sometimes those dust mites that you might not be able to see but can harbor in the sheets can inflame your airway and cause an asthma attack. And then option 5, I should avoid taking inhaled corticosteroids during acute exacerbation. If you would have read this carefully, sometimes inhaled corticosteroids are correct medications that these asthma clients will be taking. But during an acute exacerbation is not the correct time for those clients to be taking it. Those are usually long-term therapy and not acute exacerbations. So you have to read it very, very carefully and make sure the timing is correct. But good job, guys. Question number 6. A nurse is teaching a client who is receiving external radiation therapy about skincare. Which of the following information should the nurse include? Select all that apply. Option 1, alternate application of cold and hot packs to the affected area to manage discomfort. Option 2, wear a wide-brimmed hat and long-sleeve clothing when spending time outdoors. Option 3, apply lotion recommended by your healthcare provider to the affected area. Option 4, keep the affected area covered with a compression garment. Or option 5, exfoliate the affected area with a washcloth while bathing. Let me know what you guys think in the chat. Remember, read each answer choice very carefully. Just because it has the correct words that you would associate with radiation therapy, maybe it's not phrased correctly. We are looking for correct, this is a positively worded question, so we're looking for correct statement for external radiation therapy. Let me know what you guys think in the chat. Also, let me know while you're mewing over these answer choices. We're way past halfway, so I'm a little bit late to the game and asking you guys, where are you guys tuning in from? I love to see how far UWorld reaches in the world, whether you're in the corner of the world, corner of the US, corner on a beach somewhere. I would love to be on the beach. It's pretty cold here in Dallas today. Let me know where you guys are tuning from so I can start daydreaming where I want to take a vacation. Let's see who the first person is with their speedy fingers tuning in from Pennsylvania, Indiana, New York, Philippines. Where else are you guys tuning in from? Tibet, Hawaii, London, UK, California, Ghana, Denver, Iran that I never name. I never see that, so I will shout it out if I do see it. So I'm seeing it now. Atlanta, Las Vegas, Sacramento, Indonesia, Arizona, India, Texas. Fresno, California, Canada. Okay, y'all are tuning in from all over. Glad to see it. Thank you guys so much for tuning in. Truly, truly appreciate you guys. I like to see that no matter where you are in the world, no matter what time it is in the world, wherever you are, y'all are getting some NCLEX practice and studying, because practice makes progress. And that's what we want you guys to do so you can pass your NCLEX. So thank you guys for tuning in from Canada, Chicago, and Vancouver, and the Philippines, and Maryland. Okay, correct answer for this one would be options 2 and 3. So going back to the question, which of the following information should the nurse include? This is positively worded, meaning we're looking for correct interventions. So we need to read the answer choices very carefully to make sure it's right all the time. So with external radiation therapy, this is a type of radiation therapy that can cause a lot of skin irritation because it kind of can burn and cause some discomfort and discoloration and redness and sensitivity to that top layer of skin. So we want to protect all the skin that is left and be very, very careful with standard precautions, but also just protecting all the area around it to make sure it doesn't get infected, but also doesn't cause more damage because it is irritating that first layer of skin. So wearing a wide brimmed hat and long sleeve clothing when spending time outdoors, this would be a correct statement. You're protecting the skin in all the areas from the sun. The sun can be a very big irritant and can cause even more sun damage to the skin that sometimes you don't even see until it's way worse. And then option 3, apply lotion recommended by your healthcare provider to the affected area. This is correct. If the healthcare provider is providing this lotion, I saw someone say it in the chat, this is correct. Normally, sometimes the lotion can be an irritant because with perfumes and different ingredients, but if the healthcare provider is providing a lotion, this is probably a medication or medicated type of lotion or a type of sealant medication that will help the skin heal. So a healthcare provided lotion is okay. All the other options are incorrect for whatever reason. Option 1, alternate application of cold and hot packs to the affected area to manage discomfort. This can actually worsen the irritation. So you don't want to put too hot or too cold of anything on the skin because it's already very, very sensitive. So that will only make it worse. Imagine if you put an ice cube on your skin regularly, that kind of can irritate it after a while. So putting it on something that's already sensitive is only going to exacerbate it even more. Option 4, keep the affected area covered with a compression garment. Yes, we want to keep the area covered, but a compression garment will only hinder that healing even more. So this should be avoided. You don't want to add any pressure or friction to this sensitive area. And then option 5, exfoliate the affected area with a washcloth while bathing. Well, yes, you want to keep the area clean. Exfoliating it will also cause more problems. That will increase the irritation by removing maybe even more layers of the skin that shouldn't be removed. Maybe it's in that healing process. So you don't want to exfoliate that skin. You can just lightly rinse it and lightly clean it, but don't exfoliate. Leave the exfoliation for something else. Question number 7. The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all that apply. Option 1, request prophylactic antibiotics before any invasive dental procedure. Option 2, notify your healthcare provider if you develop flu-like symptoms. Option 3, take naproxen to relieve minor aches and pains. Option 4, schedule routine monitoring of your INR. Or option 5, avoid using an electric razor to shave. Let me know what you guys think in the chat. Someone said that they got 5.5 out of 6. Good job. You're working hard. Let's see how you are with this one. We're on question 7, so you might have tuned in a little bit late. Let me know how many questions you've gotten right, but also let me know. I know someone asked earlier for prioritization. Now's the time that I would love to see what other topics you guys want us to cover. I know the end of the year is coming, but maybe we can start off the new year with a bang. Maybe it's going to be that subject that you're going, or that semester that you're going into, whether it's peds, OB, critical care. I know y'all love to go over critical care or pharmacology. Let me know in the chat what you guys want us to go over. What topics, what things are you guys looking forward to? Or maybe you're not looking forward to it. Seeing some good answer choices with 1, 4s, and 5s. Sprinkling in a couple of 2s here and there. Good job, 2s and 4s. 1, 2, 4s, and 5s. Correct answers is 1, 2, 4s, no 5s. Which of the following information should the nurse include? This is positively worded, meaning we're looking for, again, the correct answers. If I haven't said it enough, always make sure you're looking for the right type of answers, whether it's positively worded or negatively worded. So we are going to include that they should request prophylactic antibiotics before invasive dental procedure. So yes, this new mechanical heart valve, this is a foreign object, but it's a very important object and a very important organ. So we want to make sure that we protect this new part by all means. Kind of like if you got a new car, you're going to protect it and keep it nice and shiny and do all the things that you need to do to keep it running. Same with the heart. So that new heart valve, we got to make sure that we're taking care of it, especially while you're taking warfarin. So requesting prophylactic antibiotics, this is true because sometimes those dental procedures can introduce bacteria into the bloodstream. And if you get a bloodstream infection, that can go to that new heart valve and cause more problems. So you actually want to be treated prophylactically to make sure that there's no infection harboring anywhere in your body. Option 2 is also correct. Notify your healthcare provider if you develop flu-like symptoms. Sickness in general is always to be concerned, but flu-like symptoms after a new mechanical heart valve is keen towards a disease process or an infection called endocarditis. So that could affect your new heart valve, your shiny new car. So we want to make sure that we're on the lookout for this flu-like symptoms to prevent it from progressing into anything worse. And then option 4, schedule routine monitoring of your INR. While clients are on warfarin, they will be having their INR because warfarin has a very therapeutic range. So we want to make sure that we stay within that range so we don't bleed out, but also don't clot while you have this new heart valve. So routine monitoring of your INR is a correct statement. Option 3 and 5 are incorrect. Naproxen is an NSAID. NSAIDs are very finicky and have a lot of contraindications with other medications. So you always look out whenever you see any type of NSAID, always look out and make sure, can I take an NSAID with this medication? So you should not be taking NSAIDs with warfarin because that can make you or increase your risk of bleeding even more. And you're already taking a medication that's making you bleed more, so you don't want to mix the two. And then option 5, avoid using an electric razor to shave. You have to read this very carefully. We don't want to avoid using an electric razor. You actually want the clients to use an electric razor. So if you would have just sped through this and read through it, you would have read electric razor to shave. Yeah. But no, you don't want to avoid it. You actually want to encourage that. So that is why it's wrong, because it's actually right, like backwards. So read it very, very carefully. Last question of the day. The nurse is teaching a staff education program about client confidentiality. Which of the following should the nurse include as an example of a violation of client confidentiality? Option 1, faxing information from a client's medical record to the receiving facility prior to transferring a client. Option 2, discussing a client's condition with the healthcare provider in the cafeteria. Option 3, texting a client's healthcare provider using a secured messaging service. Or option 4, discussing a client's plan of care during a change of shift report. Last question of the day. Let's finish off strong. Finish off strong by not giving you a select all to apply. So, Merry Christmas to you. Let me know what you guys think is a correct understanding of confidentiality. You guys are very unanimous in the chat. So good to see. Pretty much everyone is saying option 2, which is right. Client confidentiality is basically keep it a secret. No, just kidding. But you got to protect your client's health information. So you only discuss it in certain areas, which is not the cafeteria, because you don't want other people to be in your business, for lack of better words. But you want to protect your information. Don't link any diagnosis or any type of medical conditions with a client or a patient that you might have on the floor. So only talk to these providers in correct areas, which is like the nurse's station or in the patient's room. Anywhere outside of that, even in the elevator or sometimes even in the hallway, that could be a breach of the client's confidentiality. So be sure you're protecting that client's information. All the other options, 1, 3, and 4, are correct things and keeping the confidentiality underway. So faxing the information from a client's medical record to the facility prior to transferring. This is correct. You usually have a face sheet on that to kind of let the facility know, like, hey, this is protected information coming in, alert, alert. So correct information or correct thing to do. Option 3, texting a client's healthcare provider using a secured messaging device or service. This is okay because it is secured. Usually it's encrypted. If it's Epic, you have that literal secure chat that is used. So this is okay because it is secured. And then option 4, discussing a client's plan of care during a change of shift report. This is how information gets passed on. So it is okay. You guys did amazing today. I am so proud of you guys. Even with the tricky select all to apply, you guys mastered it. Thank you guys so much for tuning in. Next week, we have another good group of topics that we're going to cover before we go into our holiday break, where we won't have these question drills going on. So make sure you come back and tune in next week. And if you want to get some more studying in, visit us at uworldnursing.com, or like, comment, and subscribe. Turn that notification bell on so you can always see when we go live almost every day of the week. And then I will see you guys next week. Bye, guys.